Welcome to Northside 101, where Northside experts explain complex medical terms and procedures. Today's expert, Bonnie McKinnon.
Hi, my name is Bonnie McKinnon, and I'm a cancer genetic counselor here at Northside Hospital. Welcome to Northside 101. Today, we'll be talking about cancer genetics. We say only about 5 to 10% of cancers are hereditary. The most common forms of cancers that can be hereditary include breast, ovarian, prostate, pancreatic, colon, and endometrial, as well as other cancers. It's important to remember, since most cancers are not hereditary, it may not be due to a genetic mutation or change in the family.
What percent of breast cancers are hereditary?
So this is still 5 to 10% of breast cancer. Things we look for that may be suggestive of hereditary breast cancer include breast cancer diagnosed below the age of 50, triple negative hormone status, multiple breast cancer diagnoses in one person, male breast cancer, or a family history of breast, ovarian, pancreatic, or prostate cancer.
Does a family history of one cancer impact your risk for other cancers?
So, one cancer in a family doesn't automatically increase the risk for a secondary or other cancer. However, specific types of cancers may be suggestive of a hereditary cancer syndrome. Things to know about your family include what cancers are in the family, how old was everyone when they were diagnosed, and has anyone in the family ever received any genetic testing?
Do the BRCA genes affect men and women differently?
We all have genes in our body that help actually protect us from cancer, and mutations in them can raise our risk for different types of cancers. In breast cancer, the most common involved high-risk genes are breast cancer gene 1 and breast cancer gene 2, commonly known as our BRCA genes. For women, a mutation in this gene can bring along a risk for breast and ovarian cancer, and we can also see risk for men, including an elevated risk for male breast, prostate, and pancreatic cancer. It's important that both men and women in families be screened for these common hereditary changes.
How often should you be screened if you have a family history of breast cancer?
National guidelines recommend individuals to start breast screening about 10 years prior to the youngest breast cancer diagnosis in the family, or by age 40, whichever one comes first. Some individuals may be at a higher risk for breast cancer just due to personal and family history, and those individuals may qualify for additional breast screening, such as a breast MRI.
Are there tests available for patients to determine whether or not they carry the gene relating to breast cancer?
Here at Northside Genetics, you can meet with a genetic counselor to discuss the family history and evaluate the need for genetic testing. Genetic testing consists of a blood draw or a saliva sample if you meet criteria recommended by national guidelines. We can also send a saliva sample to your home in the case of a telehealth appointment. Again, I'm Bonnie McKinnon, a genetic counselor here at Northside. Thank you for watching Northside 101, and we look forward to serving you at the Northside Hereditary Cancer Program.